being heart healthy because it makes me feel good. I like having the energy to do what I want to do. I like waking up with a good amount of energy. I like feeling good at the end of the day. Being heart healthy by diet and exercise, knowing what my cholesterol is, lets me know that I'm doing everything I can to be here for as long as I can.
When it comes to staying heart healthy, my patients motivate me. I know that to stay heart healthy, I need to do everything I can to really walk the walk when it comes to heart disease prevention.
What motivates me to stay heart healthy is the fact that I know heart disease is the #1 killer of women. If I know that the odds of me getting heart disease is 1 in 3, I know I need to do things to keep my heart healthy. So every day I ask myself the question, what did I do for my heart today? And hopefully that meant that I ate well and that I exercise. Mostly if I can run every day, I know my heart and myself are both happy.
If you look at all the various causes of death we have, heart disease is #1, both in men and in women. Personally for myself, I think trying to eat right and exercise makes you feel better, you look better, and hopefully live longer. Controlling risk factors, preventing heart disease is probably one of the best things we can do to have a very long, productive life.
So what motivates me to stay heart healthy is that this is what I preach to my patients. So I thought that it was important that if you talk the talk, you need to walk the walk. And really personally, I have a really strong family history of heart disease. And what I've found is to be heart healthy is really quite easy. You have to eat well, you have to exercise. We all know that 30 minutes of cardio exercise 5 days a week cuts your cardiac mortality 50%. And as I tell the patients, there's no pill that can give you that.
The thing that motivates me to stay heart healthy is my son, who's now 13, and my wife. I want to stay healthy without any heart disease or stroke. I had a great uncle who had a heart attack in his 50s, and also my grandfather also had early heart disease. So having been a cardiologist for many years and seen so many people develop heart in the arteries at a young age, the thing that motivates me the most is trying to keep my lifestyle habits good so I can avoid a premature heart attack or stroke.
What motivates me to be heart healthy is to be a role model and a mentor for my patients and also my family. And that means eating more healthily. That means having smaller portion sizes, drinking more water, and taking time out of the day for myself. I take 1 hour of the day to exercise, listen to some music, and relax. And I think I have lost weight, I feel more healthy, I'm doing really well, and I think that is helping me to be a role model for my family and my patients.
I can never tell my patients what I don't do myself. So if I'm telling my patients that they should be heart healthy, they should exercise, they should choose good food choices, then I should do those myself. Taking the stairs, I cannot tell my patients to take the stairs if I don't take the stairs.
What motivates me to stay heart healthy? Well, I understand the importance of being heart healthy, so I try to exercise at least 5 times a week, and I like to go to aerobics and Zumba to do that. And in terms of eating right, I like to eat lots of fruits and vegetables, and I get new recipes that I download on my iPad to mix things up.
So unless we develop good habits, we won't be able to teach our kids to develop good habits. So we need to take the time to take care of ourselves. We need to eat right, we need to get plenty of sleep, we need to exercise, we need to control any risk factors that we may have, like high blood pressure, high cholesterol, stop smoking if we smoke.
I try to pay as much attention as I can to what I eat in order to diminish my risk of heart disease. I know that as an African American woman that I have an increased risk of heart disease and I'm more likely to die if I have a heart attack the first time around. Hence, I try to make small changes in my diet and I try to walk as much as I can and I try to use relaxation techniques to reduce my stress level.
What motivates me to stay heart healthy is the potential to run on the beach with my grandchildren, to be able to walk through the streets of Paris and enjoy the travels and life that are available to us.
Eating right and staying active is very important to me. We have a family history of diabetes and heart disease, and I'm very acutely aware of what that might mean to me as I get older.
What motivates me to stay heart healthy is the same motivator I imagine as many of our members, which is that we see patients dying of this disease every day, and so it's a motivator for me to stay healthy by exercising and watching my diet.